Welcome to the Burnout Recovery Podcast, a guiding resource dedicated to healthcare professionals on their journey to overcoming burnout. Spearheaded by Dr. Jo Braid, a certified professional coach and rehabilitation physician.
Welcome back to the Burnout Recovery Podcast. I'm Dr. Jo Braid, and today we're diving into something that could completely transform how you think about your interactions with patients, families, and colleagues. It's called the trust triangle, and I promise you, I bet you're already using parts of this framework. You just might not realize it yet. But before we jump in, let me paint you a picture. I started my locum shift one morning this week. I spend a while doing ward rounds, and the first patient we go to is a patient who'd been very recently transferred from outside of the hospital. So my team didn't know the patient, and nor did I. It was my day one. So I was spending a bit of extra time, particularly connecting with the family of that patient. And we're talking through, what's happened, what are the goals of the rehab. I'm being honest about some uncertainties of parts of the patient care, as well as challenges with communication with the patient. And I'm really listening to their concerns. Nothing extraordinary, just good human healthcare connection. Fast forward less than 2 hours, and there's a crash call. And I make the phone call to the family member after the crash call. And we go through all the things that happened. But I really believe that the conversation that I had with the family member was completely different because of the ward round that we'd had earlier. I really feel the trust was already built there. The foundation was solid. And in that moment of crisis, when the family member had actually left town to go and do something else that they had mentioned, it really made all the difference that we'd already built up that foundation in the treatment of their relative and the working relationship together. And that is the power of what I'm talking about today on the podcast. So you may not have heard of the trust triangle so far. It comes from Harvard professor Francis Frey and leadership expert Anne Morris, and is built on something that Aristotle figured out over 2,000 years ago. Trust, real, deep trust, rests on 3 pillars: logic, authenticity, and empathy. So think of it like a 3-legged stool. Remove any one leg and the whole thing becomes unstable. Logic is about competence. Do people believe you know what you're doing? And can you communicate your reasoning clearly? And are you reliable? Authenticity is about being genuine. Are you being real with people, or are you performing? Can you admit when you don't know something? And empathy. Do people feel that you understand and care about their experience? Now, here's what's beautiful about this framework. You're already doing it every single day. When you take the time to explain a procedure or the next plan that we're doing with the patient, that is your logic pillar. When you admit to a patient that you need to consult with a colleague, that's authenticity. And when you sit down instead of standing over someone's bed, when you acknowledge how unfamiliar and uncertain this must be, that's empathy. So the trust triangle isn't asking you to become someone different. It's helping you understand why what you're already doing works so well. And now I want to share with you some of the actual neuroscience behind why this works. When we build trust with others, our brains release a hormone called oxytocin. It's sometimes called the bonding hormone or the trust molecule. It isn't just feel-good science. Oxytocin really affects how our brains function. It reduces fear, it increases empathy, and it makes us more willing to cooperate. When you have that moment of genuine connection with a patient or colleague, when trust clicks into place, there's actually chemistry happening in both of your brains. And here's the crucial part. Stress kills oxytocin production. When we're overwhelmed, burned out, or working in high-stress environments, our brains literally don't produce the chemistry or don't have the chemistry needed for trust and connection. And it's a really vicious cycle. Stress reduces trust, which increases stress, which reduces trust even more. And this is why building trust isn't just about being nice. It's about creating the neurochemical conditions that allow healthcare teams to function at their best. And I'll reflect back on when that crash call happened. I didn't know most of the people that turned up to help as the call went out across the hospital. But pretty quickly, we were operating in a high trust environment, and I found the whole team were very calm, focused, structured and coordinated, and it was quite a moving moment to really be a part of, because I would say, fortunately, most of the time in rehab we don't get too many MET calls or crash calls. Now I want to talk about what happens when one of the three pillars of the trust triangle wobbles. And really in healthcare, that can be something we can notice really quickly. Maybe you're explaining a treatment plan and you can see in a patient's eyes that they're not buying it. That might be a logic wobble. Perhaps your explanation wasn't clear, or they're questioning your competence. Or maybe a family member questions you on the approach you're recommending, and there's something in their tone that suggests they think you're not being straight with them. That's an authenticity wobble. And perhaps someone says, you don't understand what this is like for us. And you realize you've been so focused on the medical aspects that you've missed the human experience. And that's an empathy wobble. The good news, trust wobbles are very normal and they're fixable. The key is to have that awareness, to recognize which pillar is wobbly, and to address that specific issue. I've got another story that I think I've shared on the pod before as well, having a spinal cord injured patient under my care, again, when I was locuming, and having some challenges that are particular to spinal cord injured patients. And I really had to bring my authenticity into the room to, say where I needed some extra help. And so I reached out to colleagues in the metro who very kindly supported me and the patient and the partner and the whole team actually with support during the whole patient stay there, which allowed that patient, or which supported that patient, to stay in a regional hospital and be treated there and have their whole rehab program there, rather than being transferred back to the metro system for a while before they returned back regionally. So with support, amazing things can happen. And I can tell you that family was so grateful that they didn't need to transfer away, and they returned to living at home with their support that they were so used to having. So you might be thinking, this sounds great, but I have barely enough time to get through all my job list, let alone worrying about trust triangles. I get it. But here's the thing, this actually saves you time. When trust is strong, patients are more likely to follow your treatment plans. Families ask fewer anxious questions because they believe you'll tell them what they need to know. And colleagues communicate more efficiently because they trust your clinical judgment. That phone call that I mentioned at the beginning with the family member after the crash call, that could have been a 20-minute conversation full of questions, doubt, and anxiety. Instead, because we'd already built that trust foundation, I will not say it was the easiest phone call ever, but it was a really clear 5-minute conversation where they trusted that I was giving them accurate information and that we were doing everything possible. And trust isn't a luxury in healthcare, it's a real efficiency tool. I've got some research that backs this up with pretty incredible numbers. Dr. Paul Zach's neuroscience research, which was the basis of his PhD on trust, shows that people in high trust organizations have 74% less stress and 40% less burnout. They're 50% more productive and have 106% more energy at work. That is incredible. That's like more than double the energy compared to places with low trust. In healthcare, where we're constantly battling fatigue and burnout, that's not just a nice statistic, that's potentially career saving. So high trust organizations also see 50% better retention rates and 76% more employee engagement. And so for healthcare systems struggling with staffing shortages and turnover costs, building trust isn't just good for morale, it's good for the bottom line. So how do you strengthen each pillar? I want to share with you some practical aspects now. For your logic pillar, before each patient interaction, I invite you to ask yourself, what do I need to know to be helpful here? Get prepared. Explain your reasoning. Use clear language. And when you don't know something, say so, but also say what you're going to do about it, bringing that reliability in. For authenticity, practice appropriate vulnerability. Share your genuine uncertainty when it's helpful. Be consistent in your values across all interactions. And here's a big one. Admit your mistakes quickly and clearly. I made an error. Here's what's happened, and here's how we're fixing it. And finally, for empathy, slow down, even if it's just for 30 seconds. A really open question is, how are you doing with all of this? Listen to the answer, acknowledge those emotions, and remember that behind every patient is a person whose whole world might be turned upside down. Here's what I would invite you to try this week. Pick one pillar, the one that feels the most challenging for you right now. Maybe you're great at the clinical stuff, but struggle with authenticity. Maybe you're naturally empathetic, but sometimes your explanations aren't as clear as they could be. Choose one small practice related to that pillar. As I've already mentioned, maybe it's taking 30 seconds to explain your reasoning before starting something. Maybe it's admitting when you're not sure about something instead of deflecting. And maybe it's asking one genuine question about how someone is coping. Just one small thing, do it consistently for a week, and notice what happens. Notice how it feels in your body when trust clicks into place. That's your oxytocin being produced and being part of your neurochemical system. And when you notice a trust wobble, because you will, we all do, don't panic. Don't try to fix everything at once. Diagnose which pillar is affected and address that specific issue. If someone seems to doubt your competence, focus on logic. Be clearer, more thorough, more reliable. If they seem to think you're not being straight with them, focus on authenticity. Be more genuine, admit what you don't know, and align your actions with your values. If they feel you don't understand or care, focus on empathy. Slow down, listen more, and acknowledge their experience. Trust repair is definitely possible, and it's often faster than you think. So here's what I reckon I know about you. You went into healthcare because you wanted to help people. You care deeply about doing good work. You're already building trust every single day through countless small interactions. The trust triangle isn't asking you to add more to your already overwhelming workload. It's giving you a framework to understand why your best interactions work so well and how to have more of them. It's helping you see that when you take those few extra seconds to really connect with someone, you're not just being nice, you're literally changing the neurochemistry in both of your brains to enable better cooperation, less stress, and more effective care. So here's your challenge for this week. Notice your trust triangle in action. Pay attention to when interactions flow smoothly and when they feel difficult. Start to recognize which pillar might need attention in different situations. And remember, you're already doing this work. You're already building trust. The triangle is just helping you to do it more intentionally. And the science shows it's one of the most powerful tools we have for preventing burnout and creating sustainable, fulfilling healthcare careers. If this resonated with you, I'd love to hear about it. Send me a message, share your own trust-building stories, or let me know which pillar you're working on. We're all in this together, and your experiences might be exactly what another healthcare professional needs to hear. Until next time, keep taking care of others, but don't forget to take care of yourself too. Trust me on that one. Cheers. Thanks for listening to this episode. Schedule a 60-minute power hour with me and leave with relief, decisions made, and clear next steps. Or send me an email for a speaking inquiry. All information is available at drjobraid.com with links in the show notes.